So we're going to be looking at our Chapter 1, your role as a first aid provider. So firstly, understanding injuries and illnesses. Most injuries and sudden illnesses do not result in death, but rather result in hospitalization, treatment in an emergency department or a physician's office, or treatment from a first aid provider. So you can see in this pyramid here that most of our injuries that we're going to come across are going to be injuries that can be treated by, us as first aid providers. And then up from that are those injuries that, may result in needing to go to the emergency department or being seen by a doctor. And above that would be injuries requiring hospitalization. So those are those more serious injuries. And then, of course, the smallest amount here would be injuries resulting in death. So the importance of first aid. It's better to know first aid and not need it than to need it and not know it. And our goals of first aid are preserving life, alleviating suffering, preventing further illness or injury, and promoting recovery. So our role as first aid providers, the first thing that we're going to want to do is recognize the fact that there is an emergency. So some factors that can help us recognize an emergency include the severity of the injury or illness, how close you are to the emergency scene, and the length of time you're at an emergency scene, a person's distressed appearance or panic-stricken behavior, previously knowing and recognizing the injured or ill person, and then scene conditions such as sights, sounds, and smells. So next, we need to make the decision of whether or not we're going to help. So some excuses that people use for not helping could be that it's harmful, you could be injured, infected with a disease, or sued. You could maybe even hurt that person. There may be obstacles in the way, such as you're not sure how to help, maybe the scene is unsafe, or maybe you feel queasy about seeing blood, vomit, or burned skin. So before helping, we are going to take appropriate actions, which are sizing up that scene, making sure it's safe, asking that person if we can help them, and doing our best to protect ourselves against disease transmission. So first things first, we want to determine what's wrong with that person. So before giving first aid, you want to check that person over and find it, fix it. And usually this is going to involve checking only a person's chief complaint, so what their main symptom is. Next, we're going to go ahead and give first aid. So based upon what you found, you're going to give first aid until either emergency medical services arrive and take over, you transport that person to a medical facility, or it's determined that the person needs only first aid and home care. So some of our first aid competencies are going to be recognizing, assessing, and prioritizing the need for first aid, providing care by using appropriate knowledge, skills, and behaviors, and recognizing limitations and seeking additional care when needed. So deciding to help. At some time, everyone will have to decide whether or not to help another person. And people are more likely to get promptly involved at the time of emergency if you have previously considered the possibility of helping others. So, if it's something that's crossed your mind, knowing that you're CPR trained, that, you have the skills to help somebody if there is an emergency, it's a good thing to start thinking about whether or not you would want to stop and help somebody. So to understand a helping attitude, or to develop a helping attitude, it's important that you understand the importance of helping and that you feel confident about helping, even if there's another person present, to be willing to take the time to stop and help somebody, to be able to put those potential risks of helping in perspective, feeling comfortable taking charge if needed at an emergency scene, and feeling comfortable about seeing a person who is bleeding, vomiting, or who appears dead. And I will say about that, deciding to help, I am one who is a little queasy myself about blood and vomit, but I find that when there is an emergency, your adrenaline is going at a point where you're not even really thinking about the blood and the vomit. You're just trying to help those people. So it's really important as a first aid responder that we are trying to communicate with the victim calmly. So we want to provide comfort and reassurance to the person that we're helping. And some guidelines for establishing the relationship with a responsive person who's had an injury or illness would be, ask that person their name and use it while providing their first aid. Make sure that your first words um, um, are calm. It's very important because they kind of set the tone of your interaction. So if somebody's injured and you run up to them and you're freaking out and you're screaming, that person's not going to feel very confident for that you're going to be able to take care of them. It might freak them out further. So any negative statements could actually add to that person's distress and anxiety. So it's important that you want to try to calm yourself first and be positive with them. Don't try to ask them unnecessary questions unless it's going to aid your treatment or satisfies that person's need to talk. So sometimes people are, a little anxious and they're wanting to chit chat to take their mind off of what's happening. You want to give realistic answers to the person's questions, but you want to try to be positive. Don't make promises you can't keep. So, for example, instead of saying you will not have pain, you can tell them that the worst is over. Also, don't deny the obvious. So instead of saying nothing's wrong with you, say, oh, you've had quite a fall, you probably don't feel too well, but we're going to take care of you. Discuss the person's condition calmly and honestly. Explain to them what you're doing while you're doing it. Encourage that person to express their feelings. Listen and don't judge. And remember that tears and laughter can be normal, and you can let that person know such if those responses are making them feel embarrassed. So providing a competent level of care. The standard of care required of a first aid provider is referred to as the standard of care. When providing first aid, you must do the following to meet the standard of care. You must do what is expected of someone with first aid training and experience working under similar conditions, and treat the person to the best of your ability. Medicine is constantly changing, and people who've trained decades ago or remember a home remedy might use outdated and unproven first aid procedures. So some of these outdated procedures include putting butter on a burn, giving syrup of ipecac for a swallowed poison, using suction for a venomous snake bite, putting an object between the teeth of a person experiencing a seizure, using pressure points to control bleeding. People trained many decades ago may not know about some of these more recent procedures that are taught to first aiders as well, such as applying a tourniquet, applying a hemostatic dressing, storing a knocked out tooth, leaving an open chest wound exposed without a dressing or seal, injecting a dose of epinephrine for a severe allergic reaction, instructing a person with low blood sugar on how to use oral glucose, advising a person having a heart attack on when to take aspirin, and knowing the method to check for a stroke. Knowing the side-lying recovery position for an unresponsive and normally breathing person, knowing how to avoid fainting, and giving naloxone for a drug opioid overdose.